right, so here are the lymphatics of the uterus, and we talked about them pretty well in class because you had questions about it. So clearly they can drain out to superficial anal nodes via this round ligament association here. They can go over to pelvic nodes via the uterine artery. They can go all the way up to lumbar nodes because they can drain along the arteries that supply the ovary and continue down to the uterus, okay? So they can go to pelvic nodes by following the uterine artery, or they can go up to lumbar nodes up here by following the ovarian artery, okay? All right. And that's going to be the main way that they're going to go, okay? Be aware of that. All right. So, here is our next picture here. And this is what we're focusing on. The superficial part of the external anal sphincter here, okay? Because you know that there's a deep part that's shaped like a donut. You know there's a subcutaneous part that really isn't terribly important, that just forms the little wrinkles on the surface of the anus, okay?
Mm-hmm.
Subcutaneous part, the superficial part, is an important part for holding and stabilizing the lower end of the anus in place. Okay, superficial part of the external anal sphincter. All right. How about this thing called the spermatic cord and its various layers? Well, the spermatic cord has 3 layers of fascia that we're curious about. One's the external spermatic fascia. One's the internal spermatic fascia. But the most important of the 3 is the middle spermatic fascia, also known as the cremaster or cremasteric fascia, because it's got muscle in it that can work like the dartos tunic of the scrotum to pull the testis up to help control its temperature. The testes are on the outside of the body because they need to be a little bit lower temperature, but they don't want to be too low in temperature. So when they get too cold, then they're pulled up either by scrunching of the scrotum with the dartos tunic or by contraction of the cremaster muscle and the cremasteric fascia. And what you want to know about that is which layer of the abdominal wall is the continuation of. Okay? So the cremasteric fascia, the cremaster muscle, is a continuation of the internal abdominal loop muscle. Okay, you got that?
Mm-hmm.
Okay. Then we're going to take a look at this deep perineal pouch thing and say, what's in the deep perineal pouch? And we're going to list them, okay? And the things in the deep perineal pouch are going to be the membranous urethra, the sphincter urethra muscle, the bulbourethral glands, and the deep transverse perineus muscle, okay? Bulbourethral glands are also known as Cowper's glands, and that's what a clinician will call them. They don't know what bulbourethral glands are. All they know is that they're Cowper's glands, okay? So those are the things in the deep perineal pouch that you want to be aware of. And then the next thing we're worried about is extravasation of urine, okay? And urine can go to a couple of different places, but the place you want to emphasize and understand is where it will go with a rupture of the urethra in the region of the bulb, or proximal in the penis. This is the distal end of the penis. This is the proximal end of the penis here, okay? The bulb is in the proximal end of the penis, and usually something that is sufficient to rupture the urethra through all of this bulbar tissue here is sufficient to rupture Buck's fascia. And in the process of rupturing Buck's fascia, it escapes out into the superficial perineal pouch and goes up into the abdomen, but not into the thigh, because we know that scarpus fascia attaches to the thigh and contains the urine and keeps it from going out into the thigh, okay? So we're up here, the proximal penile urethra results in extravasation, usually out into the superficial perineal pouch. So if you see a person with inflammation or swelling in the perineal region, in the abdomen, but clearly not in the thigh, you say, well, this person is probably going to need some repair, the proximal end of their penile urethra. So we're not going to expect to have anything happening out here. We're going to have to go in here and fix it pretty deep in that proximal urethra, that proximal penile urethra. Okay, so you deduce things, and you do a lot of deduction. You do a lot of deduction with muscle action. Now we do some deduction with extravasation of urine, where we're going to go to fix it. Okay, medicine is a lot of deduction. Okay. All right. This thing is called the urogenital diaphragm, and it's a flat sheet. And you need to know the orientation of this flat sheet with respect to the pelvic diaphragm. And the pelvic diaphragm is above this, okay? So the relationship of the urogenital diaphragm to the pelvic diaphragm is that the urogenital diaphragm is inferior. And you can see that very clearly here. There's the pelvic diaphragm coming down here, kind of a V-shaped bowl, okay? In this case, being related to the vagina and having a vaginal sphincter there, part of the pubococcygeus muscle, vaginal sphincter. And here's the urogenital diaphragm inferior to the pelvic diaphragm. How about the parts of the urethra? If you're going to do a catheterization up here, and not only do you catheterize all the way here, you can go up and catheterize into the ureters as well. Okay? You can send your instruments all the way up through here, all the way up into the ureter, and blast a stone if you need to. Okay? Pretty amazing technology, and very valuable one as well for somebody who's suffering from a kidney stone. And what you would pass through first is the penis, through the urogenital diaphragm, and through the prostate to get into the bladder, okay? People do that all the time with benign prostatic hypertrophy, and a man can't pass urine, they put in a catheter. And take out big volumes of fluid. The poor guy just felt like he had to go to the bathroom for days, and he couldn't. So he finally says, okay, I don't care what it costs, I'm going to go see the doctor anyway. And they go in there and they put a catheter in, and they drain out a liter or two of urine that he hasn't been able to pass. Because this is squeezed down on the prostatic urethra and won't let it out. Awful state of affairs. Truly awful state of affairs. Okay? So the catheter would go through here, through the penis first, through the urogenital diaphragm, and this is where it tends to hurt a little bit, because you got to bend